bag and now everything lit. I went got the bag and now everything lit. I went all the way through hell and back to get to this.
Hey guys, welcome back to my channel. It's Nurse AlissaMonae. I am so glad that you guys are continuously clicking in. You guys are commenting, showing a lot of love. I really appreciate it. You guys are liking the videos. A couple people be thumbsing down, but whatever. And you guys are really subscribing. I really appreciate it from the bottom of my heart. Like, you guys don't understand. I really been trying to put my best foot forward with YouTube. So yeah, my name is Alissa. I am a licensed practical nurse in the city of Chicago. I make videos about nursing. I want to do fashion and I want to get into beauty as well. I haven't got there yet, but you know I'm a work in progress. So this video is about why should you become a CNA before becoming a nurse, and ways that will assist you in your nursing career. So if you want to, definitely stay tuned until the end of the video, let you guys know some things. And yeah, so thanks for watching. I'm gonna start off with tip number one. I really feel like you should become a CNA before you should become a nurse, because you'll have an easier time in school. You'll know how to use the medical equipment. You'll know normal vital signs versus abnormal vital signs. You will know the basics. So when you start nursing school, basically what they teach you is the basics, but you can breeze right through them. You can ace it based off of your previous background education and your previous knowledge and experience, already having your CNA certification. So you will definitely breeze past like the nursing 101s, all of the basic classes, because you were already a CNA previously. So you will already have experience hands-on patient care. Some people are nervous touching like geriatrics, as far as like turning them, even for like paraplegics or quads. Some people are afraid to like touch them, move them, for whatever reasons, which I get it, because if you've never done it before, you're not comfortable doing it, and it's totally understandable. But if you were a CNA previously, you already have that hands-on experience. So during like clinical work rotations, you'll definitely breeze right on through the day, because you will already have hands-on experience touching the geriatric patients, moving them, changing them, assisting them with showers, whatever your clinical instructor wants you guys to do. You won't be as scared and as standoffish. You will be like ready to jump in and be like, okay, I want to get this day done. Bring me whatever. I'm ready to handle whatever for the day. So definitely being a CNA before a nurse, you won't be as scared or as nervous to do actual hands-on activities with the patients or the residents. And so the next thing why I say that you should be a CNA before becoming a nurse is because when you are a nurse, you will have CNAs who work under you. So CNAs will look up to you for like advice, for instructions on how to do specific things. Let's say if you have a new CNA coming to the floor and she's like getting trained and stuff, and if she asks you a question, she would expect you to know the answer, basically because you are the nurse anyway. So you know, people as nurses, we should know pretty much a good amount of information. Not saying that you will know everything as a nurse, but definitely you should know enough information to assist your CNA and to guide them in the right direction. As far as managing the CNAs, I feel like you will have an easier time. You already know the things to look for that they may need help with. You know better ways to answer their questions because you already have experience being a CNA yourself. And I just really feel like if you worked as a CNA previously before becoming a nurse, you already know what you would expect as a CNA. If you had a nurse managing you, you don't want to be a bad nurse. Nobody wants to be a bad nurse, even as far as with their CNAs, with the patients. Nobody wants to be a bad nurse. So if you have worked as a CNA previously, you definitely have more experience and more guidance and a better outline of the nurse that you want and the kind of nurse that you should be. The next thing that I want to say is that you will have more respect for your CNAs. I feel like being a CNA is a very, very humbling experience. Being a CNA is a lot of work. Like I said, I was a CNA previously. If you haven't watched any of my other videos, I did work as a CNA for about 2 or 3 years. And being a CNA is a very humbling experience. If you guys know, if you were CNAs before, you know that being a CNA is hard work. It's not easy. It's not a walk in the park at all. It's very rewarding though. But you will have respect for the people who work under you. You will have much more respect for your CNAs, because you know the hard work that they do on that 8-hour or 12-hour shift. You know that they are putting in work on the 16-hour shift, whatever it is that you may have it. So, you know, if you kind of like take a walk in somebody's shoes, you understand their path better. You won't think that you are better than anybody as the nurse, which some nurses do for whatever reason, but I'm definitely not the type, because I know what it's like. So like I said, working as a CNA before becoming a nurse is a very, 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 very humbling experience. Next tip is that you should definitely try to get your experience in as a CNA before becoming a nurse, because it looks good on your actual resume. Having a CNA previous experience looks good, better than a new nurse right off right straight out of school with no experience at all. So being a new nurse with no experience versus a new nurse, and she also worked in the medical field as a CNA for 1 or 2 years. Because I feel like if you don't have any CNA experience, I feel like they train you just a little bit differently. I feel like they may make your training just a little bit longer, but that's just my personal opinion and the things that I've been told. If you have a hard time being a CNA, that doesn't mean that you can't be a nurse either, necessarily. Being a CNA and being a nurse, how can I explain it? It's different. But at the end of the day, as the nurse, at some point you will catch yourself doing some things that the CNA, that you may possibly consider a CNA duty. But like I said, healthcare is very well-rounded. Whatever the nurse person is qualified to do, especially like for CNAs, you should know how to do those things as well, because it's what they teach you in the beginning of nursing school anyway. So listen, I definitely say if you have the opportunity to work as a CNA before becoming a nurse, whether it be an RN or LPN, I definitely suggest getting that experience and just seeing how the healthcare field works, whether it's long-term care or rehab, or even a hospital setting. Like, different settings bring different environments and have different work methods, but I definitely think it's definitely rewarding. At least in my case, it was very rewarding. Like I told you guys in a previous video, I really enjoyed being a CNA. Can't speak for anybody else, but I really enjoyed it. Didn't enjoy the pay, but the overall duties and the job was very rewarding as a person. So I definitely think that you guys should get that experience. And this is the end of my video. I thank you guys for watching. Please make sure that you guys are following me on IG. I definitely see all of the ladies who are subscribing to me. Leave your IGs below if you want me to follow you guys. Definitely let me know. I'll see you guys commenting, liking, and subscribing on everything, and I appreciate you. And do you guys like my scrub top? I got it from my friend Sierra. She purchased it for me, which was so sweet. Even though breast cancer awareness month is over, like, my mother has breast cancer, so I really will definitely be rocking this. I really love it. So yeah guys, thanks for watching my video. I really appreciate you all for constantly tuning in. Like I said, it's very, very appreciated. Nothing goes unnoticed on this side. So yeah, make sure you guys stay tuned for the next video. Bye.